So let's start with the physiologic anatomy of ear today. As you can see in the figure, that three parts of ear, they are color coded. The blue color, it shows the inner ear, which consists of cochlea and the vestibular apparatus. Um, the cochlea is for hearing, while the vestibular apparatus is concerned with the balance, which further consists of the vestibule itself and the semicircular canals. Uh, you can see in the figure that the pink portion that consists of the middle ear cavity, which is an air-filled cavity. It shows auditory ossicles, which are the bones, three bones present in the middle ear cavity. Uh, while the eardrum, the tympanic membrane, that sometimes is considered a part of the middle ear and sometimes that of the external ear. And then comes the uh, this orange or mustard color, and that is the external ear, which consists of external auditory canal and the auricle. Now the whole structure that is embedded in the temporal bone, uh, which has an important structure, the mastoid process. And I will tell you the function of mastoid process also, which is involved in hearing to some extent. I give you little detail of these parts now. External ear or outer ear, it acts as a funnel to channel the sound waves to the eardrum, as a result of which the eardrum it vibrates. Outer ear, it's not necessary for hearing, but still it helps. Now the external ear, it consists of mainly three parts: auricle, external auditory canal, and the tympanic membrane. Right. Auricle, it's a flap of elastic cartilage which is covered by skin, and the rim of the auricle, that is called helic, while the inferior portion, that is called lobule, that you guys already know. Moving on to the external auditory canal, this external auditory canal, this is a curved tube of around 2.5 centimeter long, and it is covered by epidermis, and it is lined by simple cuboidal epithelium. Okay, it lies in temporal bone and it leads from auricle to the eardrum. They say that near the external opening, the canal, it contains a few hair and the ceruminous glands. These luminous glands, they secrete ear wax. Uh, Regarding function, the combination of hair and this cerumen, it helps prevent dust and the foreign objects from entering the ear. So these were the parts of external ear. Now, which functions the external ear performs? Your external ear functions for sound collection and localization, and for increasing the pressure on the tympanic membrane in a frequency sensitive way. The next part is the tympanic membrane, which sometimes is considered a part of external as well as of the middle ear. You can see the eardrum in the figure as seen through the otoscope. The tympanic membrane, it's a very thin membrane, and it has a diameter of around 0.1 millimeter. Basically, it is composed of connective tissue, which is covered on one side by the skin and on the other side by a single layer of the cells of mucous membrane. And this membrane, it moves to and fro while it is buckled in the regions between the manubrium of malleus and the anterior and posterior edges. When the tympanic membrane vibrates, this vibration is greatest on the inferior edges of the tympanic membrane. What is the role of tympanic membrane? So your tympanic membrane, it acts as a resonator. What does it mean? It means that it vibrates in response to sound waves. So it transmits the sound waves to the ossicular system of the middle ear, the system which consists of three bones of the middle ear. Do you know what is resonance? Resonance, it's a tendency of a system to oscillate with larger amplitude at some frequencies than at others. Now we will move on to the middle ear. As I already told you that the middle ear, it's an air-filled cavity. And it's a small cavity in the bone, which is lined by the epithelium, and it is filled with air. And interestingly, middle ear, it communicates with your nasopharynx through the eustachian tube. This eustachian tube, it is also called auditory tube. Right. So the auditory tube, uh, normally it is kept closed at its pharyngeal end, and it opens only during swallowing and yawning, or um, voluntarily through the Valsalva maneuver. Since it opens in the nasopharynx, it may allow a pathway for infections also, especially in small children, because in children, this tube is more horizontal. So when they lie down and they are feeding, the infection, it may travel from the throat to the ear. But these children, they grow out of most of the middle ear problems as this tube lengthens, and when the face enlarges and the tube lengthens and it becomes more vertical. What is the function of the eustachian tube? So it performs mainly two functions. It acts to equalize the pressure between the middle ear and the environment, and also drains mucus. So, what other structures your middle ear contains? There are three ossicles, mean three bones, named malleus, incus, and stapes. There are two muscles, tensor tympani and stapedius, and a nerve, which is the chorda tympani branch of the facial nerve. One by one, we will discuss these. So, first, moving on to the bones, malleus. The word malleus, it's a Latin word which is used for hammer, and it is the first bone of the middle ear. Um, Now, the handle of the malleus that is attached with the internal surface of eardrum, and head of the malleus that is attached with the body of the next bone, that is incus. So, what function it performs? The primary function of the malleus, that is the transmission of sound waves or vibrations from the eardrum to the next bone, that is incus. So, what does incus do? Incus, which is sometimes also called anvil, it is the second bone in the chain, and it is located in between the malleus and the stapes. And the incus, it transmits the vibrations from the malleus to the stapes. All right, stapes, which acts as stirrup. Interesting bit about stapes is that it is the smallest and the lightest bone of the human body, and on one end it connects to incus, while on the other end it connects with oval window. And the foot plate, or you may call it the face plate, which is the base of the stapes, that fits into the oval window of the internal ear, right? And what is the function of the stapes? That is the transmission of sound waves from the incus to the membrane of inner ear. Then I told you that there are two muscles which are the components of the middle ear. and those were the tensor tympani muscle and the stapedius muscle. Right. So the as far as the tensor tympani muscle is concerned, it runs in a canal along the roof of eustachian tube, and its tendon that attaches to the handle of the malleus, and the muscle is plied by the mandibular branch of trigeminal nerve. So whenever there is the nerve is somehow involved in a disease process, say like in Bell's palsy, and there is paralysis, uh, this muscle is also affected, as a result of which some degree of hearing loss is observed. Well, the next muscle is stapedius muscle. The stapedius, that is the smallest skeletal muscle in the body, and it is plied by the branch of the facial nerve. And as the name is suggesting, it attaches with stapes, and its contraction is a reflex contraction. So the contraction, this muscle, it contracts. The contraction of this muscle that is initiated by the loud sounds as a reflex, and because of this contraction it limits the potential damage which is caused by the loud sound or noise, because whenever this muscle contracts, it pulls the stapes posteriorly and it tilts its foot plate, so the vibrations, they are not that much amplified and not transmitted as such to the inner ear. So this is how the inner ear that is protected from the loud sound. Now what is this oval window? Basically it's a membrane covered opening which leads from the middle ear to the vestibule of the inner ear. This oval window that is an intersection of the middle ear with the inner ear, and it is as I already told you, it is directly contacted by the stapes. So by the time the vibrations they reach the oval window, they have been amplified over 10 times from what they were when they contacted the tympanic membrane. There is not only oval window, but there is also another window which is called round window. Now, this round window, it functions as a pressure relief port for the fluid which was set into motion initially by the movement of the stapes in the oval window. Okay. So I told you that the major part of the ear that is embedded in the bone, in the temporal bone. And then I mentioned that the mastoid process that also is to some extent involved in the hearing process. Now this mastoid process, that's a bony ridge behind the auricle, right? And um, I find it interesting that this is the hardest bone in the body. Now, what are the functions of mastoid process? It protects the cochlea and the vestibular apparatus, and also provides support to the external ear and the posterior wall of the middle ear cavity. And it contains ear cavities, which are also called the ear cells. But unfortunately, these cavities, they can also be a reservoir of infection. But the ear cells which are present in it, they perform certain functions. So the ear cells, they act as air reservoir for the middle ear, and they also function for um, protecting the labyrinth from the temperature variations. So it means that they act also as the insulating chambers. And finally, they provide resonance to the sound. So I told you about the bones, muscles, and the mastoid process. Now, how do the bones of the middle ear, or we call them ossicles, how do they function? The ossicles of middle ear, they conduct the sound from the tympanic membrane to the cochlea. And what is the mechanism of this ossicular functioning? I will tell you in detail that how do these ossicles of the chain of the bones, they function to conduct the sound from the tympanic membrane to the cochlea, that in such a way that the handle of the malleus that is attached to the center of the tympanic membrane. And keep in mind that this point of attachment, that is constantly pulled by the tensor tympani muscle, so that the tympanic membrane, it is kept taut or tensed. Why it is kept taut? Because this tautness or tension, it allows the sound vibrations on any portion of the membrane to be transmitted to the ossicles. Then the malleus, that is bound to incus by minute ligaments in such a way that whenever the malleus moves, the incus that moves with it. And the opposite end of the incus, that articulates with the stem of the stapes, right? While the as I already told you, that the foot plate or the face plate of the stapes, that lies against the membranous labyrinth of the cochlea in the opening of the oval window. So the whole ossicular chain, it moves like a piston. So this is how the bony chain, they conduct the sound waves right from the tympanic membrane to the inner ear, which is cochlea. As a whole, middle ear performs these functions, that it transfers the vibratory movements of the tympanic membrane to the inner ear. And very important function of the middle ear is that it provides impedance matching, which I will tell you in detail. And then it protects the inner ear from the loud sounds, and that is achieved through a reflex which is called tympanic reflex. Finally, your middle ear, it provides a phase differential effect which is called the auricular coupling. Now, what is this auricular coupling? Hmm. You see that the sound waves which strike the tympanic membrane, they do not reach the oval and the round windows simultaneously. There is always a preferential pathway to the oval window, and that is because of the auricular chain. So this phenomenon, it couples the sound preferably to only one window of the cochlea, and as a result of which a differential pressure that is produced between two windows, and that is called auricular coupling. Why do we need this pressure difference between the oval and the round window? This is required for the movement of the cochlear fluids, and how the acoustic separation is achieved at that between the two windows. The acoustic separation that is achieved by actually two factors: by an intact tympanic membrane and by the presence of a cushion of air around the round window, right? So because of this separation, the auricular coupling that is achieved, and it has a significance because it contributes to the loudness around 4 decibel when the but keep in mind that the tympanic membrane should be intact for that contribution. So this auricular coupling that contributes around 4 decibel to the loudness of the sound. Right, and then there is also another mechanism which is called acoustic coupling. Okay, so this is another mechanism for the sound stimulation of the inner ear, and how it is different from the auricular coupling, because this acoustic coupling that results from the middle ear's acoustic sound pressure. Now this sound pressure, I told you, the middle ear acoustic sound pressure, that is that is produced due to the motion of the tympanic membrane and the sound pressure in the ear canal. Since the cochlear windows, they are separated by a few millimeters, the acoustic sound pressure at the oval and the round window, they are not identical because they are only by a few millimeters they are separated. Now, this difference in the sound pressure between the two windows, that is called acoustic coupling, right? And that was different from the auricular coupling. Both these auricular and the acoustic coupling, they contribute to the loudness of the sound perceived or heard or received in the internal ear. So that was one of the functions of the middle ear. I told you that middle ear performs certain other functions also, apart from the transfer of the vibrations from the tympanic membrane to the inner ear. And those functions were impedance matching and a protective reflex, which is called the tympanic reflex. So, one by one, we will discuss these functions. First, I tell you about the impedance matching. Okay, have a look at this picture. You see, a person inside water cannot hear the sound which is produced out of it. Why is that so? Because 99.9% sound it gets reflected from the surface of the water due to the impedance of the fluid. Because the fluid it has much more inertia. So this 99% 99.9% sound that is reflected from the surface of the fluid. So the question is, if the sound is reflected when it is transferred from the air to the water, then how do we hear clearly through the labyrinthine fluids which are present in the inner ear? You see, nature has compensated for this loss of energy by having the middle ear in between. And how does our middle ear compensate for this loss? It converts the sound of greater amplitude but lesser force to the sound of lesser amplitude and greater force. Okay? How does the middle ear compensate? It converts the sound which was of greater amplitude but lesser force, to a sound which is of lesser amplitude but of greater force. Now, this function of the middle ear that is called impedance matching, or it is also called the transformer action. You can call it impedance matching or you can call it the transformer action of the middle ear. So you see that how does your middle ear it compensate for the loss of the energy because of the impedance, that it matches the impedance of the fluid with that of the air. Who is this guy? Mr. Helmholtz described the impedance matching for the first time in 1868. And this impedance matching, which is also called the transformer action of your middle ear. Uh, Now, how this transformer action is achieved by middle ear? That is through these three factors. So the impedance matching that is accomplished by the hydraulic action of the tympanic membrane, lever action of the auricular chain, and the curved membrane also has a contributory effect. I give you the detail one by one. First, the hydraulic action of the tympanic membrane. And that is achieved by focusing the sound pressure from a larger area of the tympanic membrane to a smaller area of the oval window. You see, the area of the tympanic membrane, it is much larger than the area of the footplate of the stapes. So, by focusing the sound pressure from this larger area of the tympanic membrane to the smaller area of the oval window, basically what happens that the effectiveness of the energy transfer between air to the fluid of the cochlea, that is increased, right? The energy transfer, the effectiveness of the energy transfer, that is increased. In fact, the total effective area of the tympanic membrane, that is around 45 square millimeters, while the area of stapes, the footplate of the stapes, that is only around 3 to 3.2 square millimeter. So the average ratio that becomes of 21 is to 1. Okay. Uh, but the vibratory area, which is the effective vibratory area of the tympanic membrane, that is only 2/3. So the effective aerial ratio, that is reduced to around 14 is to 1. Okay. Now this hydraulic action of the tympanic membrane, that basically is a mechanical advantage which is provided by the larger surface area of the tympanic membrane, which is focused on the smaller area of the oval window. The second factor through which the impedance matching is achieved, that is the lever action of the ossicles. I tell you that malleus and incus, they behave as first degree lever system, okay? Because the handle of the malleus, that is around 1.3 times longer than the long process of the incus. So overall, this produces a lever action which converts the low pressure with a long lever action at malleus handle to a high pressure with a short lever action at the tip of the long process of the incus. Okay. So what happens that the lever action, it converts the low pressure to a high pressure. All right. And the last and the uh, third factor which contributes in achieving the impedance matching, that is the curved membrane effect, which is achieved through the buckling motion of the tympanic membrane. You see the tympanic membrane that is buckled here. And because of this buckling motion, uh, which is achieved through the attachment of the malleus, the tympanic membrane, it is kept in its most neutral position. And when it is in its most neutral position, the eustachian tube that equilibrates the that keeps the air pressure equal in the middle ear with that of the atmospheric pressure. And when the tympanic membrane that is buckled here by the attachment of the malleus, what happens that the movement of the tympanic membrane, that is more at the periphery than at the center where it is attached with the malleus. Okay. So what does the buckling motion, what does the buckling achieves? A buckling motion of the tympanic membrane that basically results in an increased force while a decreased velocity. So whenever the sound waves they vibrate the eardrum, the tympanic membrane, it vibrates with increased force but decreased velocity, and as a result of which it produces a fourfold increase in the effectiveness of the energy transfer again. So you see that how this curved membrane, it increases the energy transfer, the efficiency with which the energy, the sound energy that is transferred from this eardrum to the inner ear, because it has to overcome the impedance which is being offered by the fluid in the internal ear, which is way greater than the impedance which was being offered by the air. So, what do you uh, understand so far by the mechanism of impedance matching? So, impedance matching is a mechanism by which the middle ear, it matches the acoustic impedance between air and fluid, and it's a mechanism which maximizes the flow of energy from air to fluid of the inner ear. And it has to be done because the fluid, it has far greater inertia than the air does, as I told you earlier. And how the impedance matching is achieved? The tympanic membrane combined with the ossicular system, the bony system, that matches the impedance of the fluid, because the amplitude of the movement of the footplate of the stapes, that is around 3/4 as much as the movement of the handle of the malleus, while the ossicular system, that decreases the distance of the movement. Although it decreases the distance of the movement, but it increases the force of the movement 1.3 times by its lever action. And then also the surface area factor that contributes, because the surface area of the footplate of stapes, that is less than the surface area of the tympanic membrane. So all these factors, they cause around 22 folds increase in the force to be exerted on the fluid of the inner ear just to overcome the impedance which is provided by this fluid. So these are the, that's the summary of the mechanism of the impedance matching. And how effective this impedance matching is, that is called the efficiency of this mechanism. And the this efficiency of the impedance matching, or the impedance efficiency, that is around 50 to 75% of perfect for the sound frequencies between 300 to 3000 cycles per second. Right. So if I summarize the impedance matching, we can say that the middle ear, it converts the low pressure, high displacement movements of the eardrum into high pressure, low displacement movements, because this conversion is needed for the cochlear fluid movement. In the absence of the auricular system, the sound waves, they still can be transmitted to the inner ear, but the thing is that the intensity of the hearing, that will be decreased, and it will be so much decreased that it will be around 15 to 20 decibels less. So you can imagine that in the absence of this impedance matching, a loud sound will be heard as a whisper. Right, so I hope that you have comprehended the impedance matching mechanism, which is achieved through three factors, which is the auricular lever action, the factor of the surface area, and that through the curved membrane effect, right? How the auricular lever system helps? Because the length of the handle of the malleus, that is way greater than the long process of the incus. So that lever action, that magnifies the energy around 1.3 times. Then comes the factor of the surface area, which is called the action, hydraulic lever action of the tympanic membrane, because tympanic membrane is around 45 square millimeter, while the stapes foot plate, that is only 3 to 3.2 millimeter square millimeter. So that thing, this surface area factor, that magnifies the energy transfer around 17 times. And finally, the curved membrane effect, that also contributes, because in this effect, your tympanic membrane, that acts as a catenary lever, and the sound waves, they are much more focused on the malleus, as a result of which the energy transfer, that is magnified 2 times. So as a whole, the mechanical advantage which is provided through the impedance matching, that is of around 30 to 35 decibels. Right. So that was all about the impedance mismatch. And keep in mind that this is an important university question. So if the impedance matching is not provided, then what would happen? As I already told you, that if there was no middle ear system, then 99.9% of the sound waves, they would be reflected back from the oval window, right? So middle ear, by its impedance matching mechanism, it allows around 60% of the sound energy to be dissipated in the inner ear. So this is how the middle ear that performs a very important function of impedance matching, and the other function, which is a protective reflex, uh, the middle ear it provides, that is called the tympanic reflex. Uh, this protective reflex that is also called the attenuation reflex. You should know the alternative names. And attenuation, that is a general term, and it refers to any reduction in the strength of the signal. So when the loud sounds they are transmitted to the central nervous system through the auricular system, this reflex, this tympanic reflex, it occurs, but after a latent period of 40 to 80 milliseconds. Right. So what is the mechanism of the tympanic reflex? The tympanic reflex, it causes the contraction of the stapedius and also to a lesser extent of the tensor tympani muscle. So as a result of these contractions, the footplate of the stapes it moves out of the oval window and the handle of the malleus it moves inward. So the whole structure becomes very rigid. These two forces they oppose each other. They are in opposite direction. You see the footplate of the stapes that is moving outward, while the handle of the malleus that is moving inward. They are towards each other but in the opposite direction, and this is how they make the auricular, the bony chain system, they make this system very rigid. So when it becomes rigid, it does not transfer the sound vibrations effectively. So because of this rigidness, this reflex it reduces the auricular conduction of the low frequency sound, which is mainly below 1000 hertz. And when we say the low frequency sound, it means the loud sounds. So whenever the ear that is stimulated by the loud sounds, this protective reflex this comes into action and it hinders the transfer of that much energy just to protect the inner ear from the loud sounds or the low frequency sounds. So these are the functions of the tympanic reflex that, as I already told you, that it's a protective reflex. So this tympanic reflex, it protects the cochlea from the damaging effects of loud sounds. Then it also masks the low frequency sounds in the loud environment, as a result of which it allows a person to concentrate on the sounds above the 1000 cycles per second. Means if you are, say you are in a concert and your friend is talking to you, then because of this tympanic reflex, you would be able to focus on his conversation despite the loud sounds in the concert. And finally, the tympanic reflex, it decreases a person's hearing sensitivity to his or her own speech. The tympanic reflex that is activated by the collateral nerve signals to the muscles of the middle ear at the same time when brain activates the voice mechanism. So whenever a person it starts speaking, this reflex is initiated. because of these collateral nerve signals which are sent to the muscles of the middle ear. Because a person's own voice that is considered as a loud sound. So that was tympanic reflex. You should memorize the advantages of the tympanic reflex, which is a university question. Uh, Now I will tell you some minor definitions or introductions that what is natural resonance. That basically is the property of different parts of the ear to allow certain sound frequencies to pass more readily. For example, that the your external auditory canal, it has a natural resonance of 2500 to 3000 hertz. The tympanic membrane, it has a natural resonance of 800 to 1600 hertz, and the ossicular chain, that carries a natural resonance of around 500 to 2000 hertz. Hmm. Since we are, I was teaching you the middle ear, so we look at the applied physiology of the middle ear. Uh, that's a very common diseased condition, the otitis media. Media because mostly that is concerned with the middle ear. It is basically an acute infection of the middle ear, mainly by the bacteria, and or it may be associated with the infections of nose and throat. Uh, its symptoms, they include the reddening and the outward bulge of the eardrum, and this eardrum, it may rupture also unless the prompt treatment that is received. And children, they are more susceptible to this otitis media, as I already told you, because their eustachian tube that is smaller, and it is not vertical until they grow up, it is horizontal. So that eustachian tube that acts as a passageway for the transfer of the throat infections into the middle ear. Because their auditory tubes, they are horizontal, since they are horizontal, so they decrease the drainage. So uh, it's a common infection of children. So that was all about the middle ear. Next time we will start with the inner ear. In case of any query, you can ask me directly. Take care.